Connie Fisher, and I will be presenting a PowerPoint presentation on Fragile X syndrome. This is for Pathophysiology Assessment and Genetics at Mount Mercy University. Some of the questions that you may have about Fragile X syndrome that I would like to answer is, what is Fragile X syndrome? How is Fragile X inherited? Who does Fragile X affect? What does Fragile X look like? What is important for nursing assessment of a patient with Fragile X syndrome? And what kind of nursing teaching is necessary for families and individuals affected? Starting this presentation, I would like to explain what exactly Fragile X syndrome is. Fragile X syndrome, also known as Martin-Bell syndrome, was first described in 1943 as a form of intellectual disability. It is a genetically X-linked inherited condition. In 1969, a fragile site was found on the X chromosome, which brought about the name Fragile X syndrome. More specifically, it is the result of the changes in a gene called Fragile X messenger ribonucleoprotein 1, also known as FMR1. This gene is responsible for making a protein for the brain development. With these changes caused by Fragile X, this gene does not make this protein. It is known as the second cause of intellectual disability after Down syndrome, and it is the first most prevalent cause among males. As we learned, this is a genetic condition, so you may be wondering, how is it inherited? Fragile X is a genetic disorder affecting one's genes, and it is passed down from parents to children. We already know that Fragile X occurs within the FMR1 gene. Let's look deeper. All genes and chromosomes have a specific code or chemical letters, which is known as our DNA. In a normal gene, the CCG code repeats a maximum of 45 times. In an individual with Fragile X, their FMR1 gene, CCG code, repeats more than 200 times. This overproduction of CCG repeats causes the FMR1 gene to shut down and no longer produce that vital protein responsible for brain development that we discussed. As the gene mutates from generation to generation, there are different levels of mutation. A normal FMR1 gene in a healthy, unaffected individual has 5 to 45 CCG repeats. This person is healthy and has no chance of passing on the mutation to children. An intermediate mutation has 45 to 55 CCG repeats. This person does not have Fragile X and will not have a child with Fragile X. However, they may have a slightly higher chance of having associated Fragile X conditions and passing those conditions to their children. These conditions are Fragile X associated primary ovarian insufficiency or Fragile X associated tremor ataxia syndrome. Premutation is the next step, and it has a CCG code repeated 55 to 200 times. They do not have Fragile X, but have a much higher risk of associated conditions that were listed above. Women with premutation has a 50% chance of passing on a pre or a full mutation to her children. Man with a premutation will 100% pass on a premutation only to his daughters, but will not pass on anything to his sons. Full mutation, more than 200 repeats of the CCG, have Fragile X syndrome. Individuals with full mutation have a 50% or higher chance of passing on full mutation to their children. This diagram will help to show how Fragile X syndrome can be inherited. For example, if the father is unaffected and the mother is a carrier, or or has a premutation, as it would be called. Diagnosis of Fragile X syndrome. Fragile X syndrome can be diagnosed with a simple blood test to an individual suspected of having the condition. It can also be done to determine if somebody has a premutation or is a carrier of Fragile X. This testing is often done during pregnancy to determine if you or your spouse would be carriers, putting your unborn child at a higher risk of developing Fragile X syndrome. If it is determined that the baby is at an increased risk, or if mother or father have the mutation or premutation, an amniocentesis could be performed to determine if the baby has the full mutation. Who does Fragile X affect? Fragile X syndrome affects both males and females. However, males more often than females are affected. Females oftentimes have less severe symptoms than males. It is estimated that 1 in 7,000 males have been diagnosed with Fragile X and 1 in 11,000 females. The statistics of women carrying the premutation is 1 in 850 for males and 1 in 300 for females. What does Fragile X look like? Clinical characteristics physically for those who suffer from Fragile X syndrome include long face, macrocephaly, or a large head, prominent ears, prominent jaw, flat feet, joint hypermobility, and macroorchidism. Some of the psychological characteristics are attention deficit hyperactivity disorder, anxiety, and autism spectrum disorders. Developmentally, many individuals suffer from intellectual disabilities and language deficits. Some of the other things that often happen with people who have Fragile X syndrome and have been found among those are strabismus, recurrent otitis, gastrointestinal complaints, obesity, and seizures. Below you will see 2 pictures of some of the common physical features of those with Fragile X syndrome. Some of the nursing considerations when caring for those with Fragile X syndrome, or when considering if somebody may have Fragile X syndrome, are developmental delays and intellectual disabilities. Both walking and speech are delayed. The IQ of affected individuals, studies have found affected males have a mean IQ of 41 to 50. Women, mean IQ is 70 to 90. Whereas the average IQ of an unaffected individual is 100. Developmentally, those with Fragile X generally deviate by 6 months from general population, with all domains of development, fine motor, visual reception, and communication will be delayed or could be delayed. Seizures are present in 10 to 20% of boys and 5 to 10% of girls. Age of onset typically between 2 to 10, and the occurrence tends to decrease with age, although in 25% of individuals with Fragile X, seizures can continue into adulthood. Obesity. Adult individuals with Fragile X have equal prevalence of obesity. However, children with Fragile X have a 31% occurrence of obesity versus unaffected children with an 18% occurrence. Psychiatric features are very common among those who suffer from Fragile X syndrome. Intellectual disabilities are rarely presented alone in Fragile X. Psychomotor delay is oftentimes the first sign in children of intellectual disability. These individuals are at a high risk of developing one or more psychiatric disorders, such as autism, anxiety disorders, ADHD are the most common. It is estimated that 30 to 50% of males with Fragile X have autism and females 25%. More than 50 to 66% of individuals with Fragile X have ADHD and 74 to 84 have anxiety disorders. 90% of affected individuals have behavioral issues such as stereotypies, generally hand and finger mannerisms, sleep problems, social phobias, selective mutism, compulsive behaviors, self-injurious behaviors, and aggressiveness. It is important to understand that everyone with Fragile X syndrome are different. They have different abilities, different intellectual abilities, and different physical abilities. They also have different behaviors. Each patient will need to be assessed by the nurse for their individual delays and health concerns, and each of those needs need to be addressed to help manage the patient. Speaking with the family and patient about their specific needs will help to determine their individual care plan. They will require a range of services from therapy, both occupational, speech, and physical, medical doctors, psychiatrists, and many more services to help assist the individual and family. Some things that should be considered in patient education of those affected by Fragile X. First and foremost, patients will more than likely have questions about how their child, or if they are being diagnosed later in life, how they themselves acquired this condition. This will be a sensitive subject, as this brings on the possibility of other members of the family having children with Fragile X syndrome, or being carriers of Fragile X syndrome. This is something that should be referred to a genetic specialist, such as a medical geneticist and genetic counselors. As a nurse in general, we should have a basic knowledge of genetic conditions and how to refer patients and their families and provide teaching for individual symptoms of genetic conditions. This is a basic overview of my presentation. Fragile X syndrome is a genetic condition passed on from parents to children. Affected can have different levels of mutation of the gene causing Fragile X. This condition affects males more often than females. This is the second leading cause of intellectual disabilities and first leading in men. This causes physical symptoms and psychiatric symptoms. There is no treatment for this condition, but it can be managed with a multidisciplinary teams and assessment of individual symptom management.